Thank you very much, Mr. President. I rise today to discuss the Medicare Advantage program again. It's one that is facing nearly $120 billion in cuts under the Democratic health care bill. And currently, there are nearly 11 million seniors enrolled in Medicare Advantage, which is about 1 out of every 4 seniors in the United States. In my home of Idaho, that's about 60,000 people, or 27% of all Medicare beneficiaries in the state. Medicare Advantage is an extremely popular program. In fact, it's probably the most popular and fastest growing part of Medicare. A 2007 study reported high overall satisfaction with the Medicare Advantage program. 84% of the respondents said that they were happy with their coverage, and 75% would recommend Medicare Advantage to their friends or family members. But despite this popularity of this program, the massive cuts in the Reid bill will result in most seniors losing benefits or coverage, or both, under Medicare Advantage. I've shown this chart before, and you can't really see the individual states too well in it from this distance at this size, but you can see the coloring on the United States here in this chart. If you live in a state that is red, deep red, or the pinkish color, which is almost every state in the union, then you are going to see your benefits cut under Medicare Advantage, under this bill. Now, why am I bringing it up again? We've already had a vote on it. In fact, we've had 2 votes on it, and the majority has insisted on keeping these cuts in the bill. Well, the reason I'm bringing it up again is because as we have combed through this 2,074-page bill, we have found out that there's a provision in the Reid bill that would protect Medicare Advantage benefits for some people in the United States, for just a few in this country. During the Finance Committee markup, Senator Bill Nelson of Florida advocated on behalf of Medicare Advantage and of the beneficiaries in his home state of Florida. And subsequently, during closed-door negotiations, the legislative language was added to protect those beneficiaries. Now, this is interesting, because one of the responses to us as we have tried to stop the imposition of these cuts to Medicare has been that this bill won't cut any Medicare benefits. Well, if not, then why does Florida need a special exemption for its citizens? If not, why not support the McCain Amendment that would give the same protection to all Medicare Advantage beneficiaries that the bill gives to just a few, in Florida primarily? Specifically, Section 3201G of the Reid bill, buried deep in the bill on page 894, has a $5 billion provision drafted to prevent the drastic cuts in Medicare Advantage program from impacting those enrollees who reside primarily in 3 counties in Florida: Broward, Miami-Dade, and Palm Beach. It seems unfair that taxpayers would foot a $5 billion provision that provides protection for only some of the Medicare Advantage beneficiaries. But it certainly proves that there are cuts to Medicare Advantage benefits in this bill. Again, benefits that 1 out of 4 beneficiaries in America receives. One of the fastest, if not the fastest, growing parts of Medicare. Instead of preferential treatment for some, why not extend these same protections for Medicare Advantage to all beneficiaries under Medicare? I know that the 60,000 Medicare beneficiaries on Medicare Advantage in Idaho, my home state, want and deserve that same level of protection. That's why, Mr. President, that I'm here to support the McCain motion to recommit, and that's what his motion to recommit would accomplish. Very plain and very simple. The McCain motion would extend this grandfathering provision to all beneficiaries in the Medicare Advantage program so that all seniors in this popular and successful program could maintain that same level of benefits that today they enjoy under the current law. Every senior in the Medicare Advantage program deserves to keep these critical extra benefits, which include things like dental protection, vision coverage, preventive and wellness services, flu shots, and much more. In fact, most people who are not on Medicare Advantage in the Medicare program have to buy supplemental insurance to get this access to this coverage. Those in Medicare Advantage, which is one of the reasons it's such a popular program, have the opportunity to get it through their Medicaid services. And why is Medicare Advantage so Opposed? Well, some say it's because of the extra cost, except that the extra cost in Medicare Advantage is returned to the government or shared with the beneficiaries. I think the reason might be because Medicare Advantage is one part of the Medicare program that we have successfully been able to turn over to the private markets for operation. And interestingly, when the private sector gets involved in administering this part of the Medicare program, the Medicare beneficiaries get more benefits, and it becomes the most popular program, Medicare. I know that my colleague from Pennsylvania, Senator Casey, has filed an amendment to protect the 864,000 Medicare Advantage beneficiaries in his home state. And I would expect strong bipartisan support for the McCain motion to commit, since I think every senator representing their constituents in their state wants to see this kind of protection. At the end, the McCain motion to commit is simply an amendment that will protect nearly 11 million seniors today enrolled in the Medicare Advantage program and help to keep the president's promise when he said, if you like what you have, you can keep it. If this bill is not amended in the way that it is being proposed to be amended by Senator McCain's amendment, 11 million Americans are not going to be able to keep what they have in the Medicare program. And that's just a start on the impact of what people in America are going to see under this legislation in terms of a reduction of their benefits and the quality of services they have access to. Mr. President, I urge my colleagues to support this amendment, and I yield the floor.